Hi, good morning, everyone. My name is Amy Peters, and I am a social worker with Crater Community Hospice. I'm just going to take a minute to kind of give you my background. I have been a hospice social worker for almost 15 years. Before that, I worked in long-term care facilities, nursing homes, and it was there that I fell in love with hospice. As a social worker in a long-term care facility, I never felt like I was really able to get to know the residents, get to spend time with the families. And when we had a resident pass away, um, I never felt like we were able to give them as much support as when the hospice team was involved. I then got the opportunity to join hospice, and I was a little nervous, to be honest with you. I never felt like I really knew exactly what to say to family members or to kind of make it better when somebody passed away. And I'm going to share some advice that I got when I first started hospice that kind of helped me bring everything into perspective with hospice. Um, so again, like I told you, I was looking for some magic phrase, some magic thing to do to make it better when somebody passed away. You know, what do you say to a family that's grieving? I never knew that. I didn't know exactly what to say. I always felt like it was an awkward moment. Um, and I am a fixer. That's just my personality. I want to fix things. I want to make things better. So I started in hospice and I thought, okay, I'm just going to wait here for this magic potion. And I was towards the end of my training where we were doing some ride alongs with some different staff members. And I was riding along with our chaplain at the time. And we were getting close to the end of our training. And I'm still yet to figure out this magic phrase, this magic thing that I needed. I felt like I needed to do and have in order to succeed in hospice. So as we were riding along, sure enough, we get called to go to a patient had passed. And as we're getting there, I said to the chaplain, I said, I'm yet to learn, what do I need to say and do to make it better for that family when I get there? And she looked at me and she said, you don't need to make it better. That family is not looking for you to come in and make it better. That family is just looking for you to come in and comfort them and be there for them. And I thought, no, that's not it. I want something. I want a phrase. I want to do something. So sure enough, we got there. And of course, I was with the chaplain. So she was able to say a prayer, which prayer brings a lot of comfort when our patients pass away. And I was able to do that. And we sat there. And she was able to hold the hand of the wife of the patient that had passed away. And it was silent. And at that point in my career, I wasn't comfortable with silence. I wanted something said. I wanted something to be done to make that situation better. But we sat for quite a while as that wife cried and shared stories of her husband. And as we were going through this visit, it hit me. She didn't need us to say anything. She just needed us to be there, hold her hand, and let her talk. And we were able to do that. And when we left, I said to the chaplain, I said, I really appreciate you giving me that insight that silence is a good thing sometimes. Just sitting with someone and being present is all they need. Now, sometimes they need a hug. Sometimes they need more than that. But for the most part, they don't. They want you just to be there and to show that you care and that you're listening to their stories. And I know as nurses, you guys are seeing this a lot right now. You're dealing with COVID deaths, and I can't imagine what you're going through on a daily basis. But what I do know that you're doing for them, for those patients, especially because they don't have their families there with them, of course, you're taking care of them. You're meeting all their physical needs. But by just sitting there, by being present, you don't even realize how much that's truly doing for them, to know that they can count on you to be there and that you care enough to sit and listen, or help them write something down, or make that important telephone call that needs to be made if they're still able to make those phone calls. It's truly those little things that mean more than what we in our mind perceive as these big things that we can't always do. And that's not always what needs to be done. And I also received another piece of advice when I first started hospice from this same wonderful chaplain. She said, well, because I asked her, I was worried about doing this job day in and day out and the emotional toll that I knew it was going to take on me. And I asked her, how do you deal with that emotionally? How do you separate what we do every day, all day, from what I'll call our real lives, where our personal lives are? And she said, Amy, you have to realize and you have to remember that that patient that you're taking care of was not your mother, is not your father, is not your grandfather, your friend, your husband, whatever it might be. And when you take yourself out of it, you then leave yourself more open to be available to that family. Because when we make it about ourselves, and we can't always help that because that patient might remind us of our grandmother or our mother or someone else that we've lost. It's hard to sometimes do that separation. But when you always are cognizant and aware that this isn't about you, this isn't your family member, it leaves you more open to be able to provide that support and that presence that that family needs. And I've lived by that. And that's also another word for that is called boundaries. It's knowing when to separate what we do professionally from what we're feeling and doing personally. And I know, unfortunately, like I said, I've been in this for 15 years. I've met a lot of nurses, especially that don't create that boundary. And they're going on their personal time to spend time with that family. They're making that family and that patient become a part of their family. And when that patient passes away, it's like you've lost your family. And that does not leave us any room then to be professional and to be compassionate and empathetic, of course, but it becomes about you. And I've actually seen nurses that needed to be comforted by the family that you're supposed to be comforting. And at that point, you've crossed the boundary and you're not available to do what you're supposed to be doing. And you're supposed to be that professional helping take care of that family. And like I said, being present and being available to them at that point. So that's another piece of really good advice that I've gotten, that I've lived with and tried very hard to do. Because this is an emotionally draining job. And we did another little talk a few minutes ago on self-care. And I think you can't talk about death and dying without talking about self-care as well. We have to be taking good care of ourselves. And that comes physically, emotionally, spiritually. We have to be in a good place ourselves. And we have to be able to be available to help and guide our patients and families, because a lot of times we all see this working in healthcare. You have a family that's all on the same page and a patient that's ready to pass and everybody's in a good place. But then there's that one family member that is, I'm not ready to let daddy go, or I'm not ready for this to happen. We've got to always be prepared for that one family member and giving them the tools that they need to come face to face with that passing that is about to happen, and making sure that we're able to do that and get them to that good place is a lot of what social workers do. And I know you guys as nurses do that as well. And I also like to give advice to some of our new nurses that start in this. We function as a team. This is not a one-woman show or a one-man show, especially in hospice. We are a team and we have a team approach. And that is because we don't want one nurse or one social worker or one chaplain getting the brunt of everything that goes on with that family. We all bring a different perspective and different tools, different resources to the table. And that only benefits the family. And I think that we can help you guys as nurses too realize that you are not a one woman show either. You have a team of people around you as well. I'm sure right now dealing with COVID, you feeling like you're a one woman show or one man show, being that nurse, because you really are probably the only one alongside maybe the doctor that can come into that isolation room and can be that. But you have a team of people that can still provide things, even if they can't come into that room. They can still provide things. They can still make phone calls to family members and be available, even if it's on the just on the telephone. And I suggest you heavily rely on that team of people, whether it be your hospital social worker, your hospital chaplain. Those people are still there behind the scenes and they can be reaching out to family members. That way, you're not having to take those phone calls throughout your whole shift of that worried family member that's there at home and can't see that loved one. And we all know how that feels when we can't be with our loved ones when they're sick. That causes anxiety and stress. And you've got these family members that are calling, wanting to talk to you on the phone. Well, you can't be present with your patient if you're having to deal with the family. Let your other team members deal with that family if they can, to give you that extra support. And like I said in the beginning of this, you guys are the real heroes in this. Dealing with COVID right now is absolutely unfathomable what you guys are seeing and having to deal with every day. Please just take into account some of the things that I had said, some of the advice. Take care of yourselves. And thank you for all that you do. And please give yourself that credit that you guys deserve, as you guys are the real heroes in all this. Thank you.